you, everybody. Again, I want to thank everybody for coming down. I want to thank Jeff and Sultan for having me here. And just wanted to tell you a little bit about myself. I've been in practice for 15 years, and then 2 years ago, I saw on Instagram with a gentleman, and he was ripped up, and I was like, well, I don't know how to do that. And so we looked into it, called Ali and talked, and it was actually Chris Fortandi's photo. We're like, okay, this is what this does. All right, well, let's try it out, because I don't know how to do that. In all sincerity, I could not get a result like that. And I've been liposuctioning for 15 years. So we got into it, and we got into it knee deep, and it's probably been the best thing I've ever done in my career so far. It's been the most satisfying because the results are so impressive. And so just to do something that nobody else can do is special. And it's been rewarding both financially and just my own personal satisfaction, because the patients are so thankful when you make a transformation happen. So we started doing it, and you know, you get better and better, and first 6 months are a huge learning curve, and you just get better and better results. And I didn't know anything about the nomenclature, nothing. I just started using it, and then once I started getting some really nice results, I started throwing out high definition liposuction out there. Because I thought, hey, this change was dramatic, high definition liposuction. And that's when Grant got a hold of me and said, hey buddy, slow it down. He says a high definition liposuction, when you use that term, it has to be a 10. Not just you made a big difference, it's gotta be, you know, as Grant says, what I can get is a high definition liposuction. What everybody else can do is vaso liposuction, but don't use that word loosely. And then I was thinking to myself, well, because that sounds good, it's a good word, right? I want to say I could do high definition liposuction. So then we got into a powwow about what it really means, and for me, I thought if you make a big transformation in someone, really change them dramatically, that should be high definition liposuction. His terminology was that, no, it has to be a perfect 10. And I'm sure you guys got wowed by his results on Friday. I got here a little late. But, you know, not everybody can be a 10, right? A perfect 10. That's Grant's definition of high definition liposuction. So I came around and I started working and doing all this and that. And so I have come up with my own high definition liposuction terminology and my own protocol to get people to what I call high definition liposuction. So let's just get started, because I know we want to get through it. So to get high definition results, there's two factors involved. First, you have to master the vaser. You have to understand what it can do. You have to understand human anatomy, which is why we were here today or this weekend. You have to have the appropriate training. I've trained with Grant 4 times now. And every time he comes by, I thought I had it down, and then I learned something again. And every time he comes by, I learn something again. And I just get schooled, right? Experiences, again, everything. So in 2 years, I think we've done about 270 full circumferential cases now. So now I have an armamentarium. And as I do more cases, I raise my prices. So at this point, financially, we're really doing well. And it's because of Vaser. I do everything. I do faces, noses, eyes, breasts, tummies. But as you get better, you get more before and afters, you raise your prices. And if Grant was here right now, he'd tell you. I started at the bottom, and every time he came, he made me raise my prices. You have to be an artist. We'll go through these pictures today, but you got to create I tell my patients I treat them like they're a statue, and I want to get the most beautiful statue I can. And that's why I do only circumferential. Nobody comes to me for like a little thigh here, a little banana roll here or that. When they come to me, I undress them and we turn them around and we look at everything and we decide how am I going to get this patient to what I consider high definition liposuction. And then, as you guys did the whole day, I mean, that was beautiful. beautiful, accurate preoperative markings. They're everything. If you lose your markings, Hammond will tell you. He'll extubate him, put him back up, and remark him, and then put him back down. So the roadmap is critical, okay? The second thing is patient selection. And so patient selection basically will define your strategic sound operative plan. It's everything. You have to know who you have and how far you can get them and how, okay? So I came up with my HDL body scale. And so I'll teach it to you today. I call it the High Definition Liposuction Body Scale. And it's intended to help us all have a sound strategic plan to get patient from A to B, okay? And I'm just gonna, again, this reiterates. So my HDL body scale goes from a 2 to a 10, okay? We don't want to use 1 because we don't ever want to say somebody's a 1. So I started at a 2, and 3, 4, 5, 6, 7, 8, 9, 10. And my definition of high definition liposuction now is not a 10 because I can't get a 10 every time, or not even, 10 is a 10. So I said, if you're a 9 or a 10, if you're a patient and you come to me, and I can guarantee you that I can get you to a 9 or a 10, to me, that's high definition liposuction. So that's a little different in terminology. So let's just look at this. So look at those schemes right there, the gentleman on the right. They go from a 2 to a 10. I like to call 10, and I haven't convinced Hamlet of this, I think it should be ultra high definition, is a 10. I think if you can get a 9 or a 10, your patients will love you. So we have 8, 7, 6, 5, 4, 3, 2, and it is all based on how much fat you have, how much skin you have, and I alluded to this on Friday, and the texture of the skin, the quality of the skin. There's 3 parameters. And if we go down through these, let's see.
Sure it's on. Might have turned off.
Oh yeah, it's just light. Okay, so 9 or 10 denotes near perfection. 7 to 9 is minimal fat. The skin is tight, the texture is excellent. 6 to 7, there's minimal to moderate fat. There's minimal skin looseness, and the texture is still good. When you get to a 5 or 6, there's moderate to severe fat, and there's a moderate looseness, okay? And there could be localized areas of poor skin texture. And then at 2 to 5, there's moderate to severe fat excess, severe skin redundancy, and diffusely poor textured skin. How do you guys feel about that?
And instead of moderate to severe fat, it's very, can we do it like BMI type of thing? Easier?
Yeah, you can do it all. You can translate this to a BMI chart. But you'll see, by the end of today, it's easy. I'm going to flash pictures and you guys are going to say, everyone's going to agree. That's a 7, that's a 6, that's a 4. BMI, you have to do calculations. But it makes sense, right? This guy right here, he's a 2. He's just far gone, And anything below 5 is really far gone. The 5 and 6s are okay. They need a little bit of skin tightening. And then the 7 and 8s, so here, let's go through this. Here's the female version, same thing. 2 through 10. When you get the HDL body scale down, not only is it going to help you with your strategic operative plan, but it's also going to give you a way to objectify your results. Because you can say, I took you from a 5 and I brought you to a 7. I promise a 9 or a 10, okay? So here's how it works. If you're a 7 or an 8, I can get you to a 9 or a 10 with Vaser alone. If you're a 6 to 7, I can get you there with Vaser and Renuvion. No cutting. If you're a 5 to 6, and these are not hard numbers, but you'll get a gist of it by the end of this talk. If you're a 5 or 6, I do a Vaser and a mini tuck. And I'll get into that. And if you're a 2 to a 4, then I'm going to stage your operative plan. Meaning you're going to come and get a full body tuck, and then I'm going to bring you back 3 months later, because I'll take a 2 to a 4, I'll pull her up to a 6 or 7, then I'll come back and I'll hit the 6 and 7 and take them up to a 9 or 10. Again, we know what Vaser is and what it does and how amazing it is. The reason the Vaser works for a 7, so an 8 is near perfection, right? So that's easy, yeah, Vaser them and they're gonna look amazing. The reason Vaser works for a 7 is because we're taking out that superficial fat right here, as well as what we used to take out in the deep with traditional. And I think that superficial fat removal circumferentially allows those retaining ligaments to tighten, and you get some re-draping, and the skin actually just goes up to the muscle and hugs it. Renuvion was here this weekend too, and so Renuvion, we all know what it is, right? Does anybody confused about subdermal coagulation and what we're talking about? Everybody's clear on that, right? It really tightens it. The analogy I use is it's like a steak. You get the steak and it's raw and you put it on the grill. By the time it's cooked, it shrinks. It's like shrink wrap. There's a flame on that Renuvion, and I think it's just cooking that dermis tight. And there's no going back. I don't think they're going to go back because I think that dermis is denatured and that protein just shrink wraps and you're done. And it happens instantaneously, and there's no change in it. In my mind, it doesn't keep getting tighter or get looser. It's been permanent. So I've been using it for about 2 years. It is what you see on the table is what you're going to see a month later, 6 months later. What do I mean by mini tuck, right? So 5 to 6, I can mini tuck them and still use the Vaser. Because with a mini tuck, there's no undermining, right? So it's safe. If you don't undermine, you still have your vertical perforator blood flow, and then you can Vaser them and compromise, whenever you lipo, you're compromising horizontal blood flow to some extent. So mini tuck to me means mini in the bottom if there's abdominal looseness low. I do reverse tummy tucks if the looseness is high. Medial thigh tuck, brachioplasty, upper body lift, and lateral thigh tuck. None of those procedures require undermining. It's a wedge excision. Right? And then a full tuck to me is a full tummy tuck where there's undermining. You're cutting huge amounts of skin, lower body lifts. Sometimes I'll do total body lifts. I'll do a breast lift, upper body lift, brachioplasty, full tummy tuck, lower body, medial thigh tuck. Tuck them down and bring them up that scale. All right, you guys ready to look at some results?
How long do you wait between?
3 months minimum.
3 months?
After a full tuck, it's 3 months minimum. I prefer 6 months. One of the things I'll show you today is when you're tucking, that seam line, wherever that seam line is, tends to contract down like a belt, and it creates a contour irregularity. When you look at a tummy tuck, what's not pretty about it is that deformity of the contour irregularities. And if you let them simmer for 6 months, that tightness will complete itself, so you can see exactly what the irregularity is that doesn't make that tummy tuck pretty, and with Vaser, you can completely efface that incision. Because when it's smooth, you don't see the incision. It's only when there's shadowing into the incision, if there's a little shelf, for the tummy tuck, that's when the incision becomes apparent, okay? All right, here we go, you guys. So, this is a 23-year-old. She came to me, beautiful body, young. She's an 8. She wanted to be shredded. So, that's how we do it. We shred that muscle out. Look at her muscles. They're not symmetric. They're not, it is what it is. My job is to remove all the fat. If they want to be shredded in the abdomen, and they want to be a 9 or a 10, that's what you do. You can see everything on her. You can see the beat of the P's here. She actually works out, so look at her external obliques. Look at her rectus muscles. It's just smooth and beautiful, and that's her. And that's an 8 to a 9 or a 10. Let's look at some more views on her. So that's on the abdomen. So I actually grade them individually, meaning regionally. So I'll grade the belly, I'll grade the legs, I'll grade the back. So on the front she's an 8, and now she's a 9. The back she was an 8 too, I think. And did some butt work with her. We worked on this yesterday. So these flanks need to come out. These lateral thighs need to come out conservatively. And and we want to add to the mid-butt level. Okay? Here's a 7. So look at her belly. It's got a little bit more skin. It's got a little bit more chub in there. She's still beautiful. But she came to me and she wanted to maximally narrow her waist and she wanted to maximally increase her bottom. I want everyone to appreciate the curves. Yesterday there was a moment where we had Grant's double fist technique. Did everybody get to see that? And he's grinding away. And when he's grinding, he is paying attention to this curve. You don't want to shelf, right? You don't want to come off the button, dive, jump in, fall down. You want that beautiful curve. So that's where the artistry comes in. That's where the experience will come in. You'll get better and better at carving. Here's your other oblique. So I put this slide in with the markings just to show you. Now she so happened to also get a breast slip of Og at the same time. But those are the markings. Now, if Grant was here, he would say that's not a 9. He would say that's not high def because she didn't want to look like a masculine belly. She just wanted to be leaned out. But he would say, well, that's not a perfect 10 on the belly. Okay, so look at this patient, you guys. This is a 6. If you look right here, there's a lot of skin. There's a lot of fat. There's looseness right here. There's looseness down here. So how did I get her to a 9 or a 10? She's hot. If you see her, those curves are to die for. The butt, beautiful. Everything's there. Her abdomen is firm. She's shredded in here. Her muscles aren't as strong as the previous girl. So how do we get her that? Vaser and Renuvion. I Renuvion everything. I Renuvion her entire belly. I Renuvion her back. Let's just look at her. You want to get beautiful curves for females. More linear lines for males, right? Let's look at her back. I Renuvion here. See those rolls? We're just getting ready to publish a paper where we've done 20 backs with Vaser and Renuvion, all in a row. And you'll see these rolls. I'll show you today. All these rolls are gone.
So you're doing some lipo after Renuvion too then?
What am I doing?
Well, you know how normally you would do lipo then Renuvion, but are you doing lipo, Renuvion, and then doing some more refined lipo after?
No.
You're doing it all before and still getting that Renuvion through where you etch down?
So I'm doing everything Vaser,
Right.
done. I'm not going to leave a piece of fat and then go back to get it again. We get done with all the fat removal, which increases the skin laxity, which allows you then to make a determination of what you got to do to get them down tight again. Right?
I guess what I'm saying is when you're doing high def and you're etching like in that, down the center, or you know how you're going real superficial.
Subdermal plexus.
Right, you're doing that before and then getting Renuvion in under it, isn't it gonna?
Yeah, so
So you're doing your deep grooves and then Renuvion after that?
no, I'm doing Vaser, high definition work for all the details,
Right,
and then globally debulking them
right,
to the point where I'm done.
right. And
There's
then
no
you're-
more going back.
No, then you're doing Renuvion.
Then I go
at the end.
to do the Renuvion at the end, one time. Yeah, I don't go back to lipo again, that's it.
Ari, how long do you spend, like time-wise, how long does it take to do a full back? How long does it take to do a front with Renuvion?
So now I have a team, right? We're like a team. We actually had 2 Vasers and 2 J plasmas at one point where we're just, and there's 3 of us. It's me and my two guys that I've trained. So we knock it out. So we do a whole back in an hour, hour and a half, routinely now. If they're bigger girls, they take a little longer, but and then the front takes a little longer, hour and a half to 2.5.
That's just the Renuvion part.
No, the whole thing. The whole show takes 4 hours or less.
What order, do prone first and then?
Good question. Do I do prone first or supine first? Every single patient that I have is going to get fat grafting to the buttocks, sometimes fat grafting to the breast. So whether I start supine or prone is dependent on what kind of butt they want, and I'll show you today how we do that. And how much fat they have on the back. If they have enough fat on the back to get the butt done, then we start prone. If they don't have enough fat, then I'm going to start supine, grab all the fat from the front, flip them on the back, grab anything I can get, and do the butt. I charge patients to remove the fat. That's the grind. When you get into this, you'll see it's a beautiful thing. I mean, you are working hard. I think in the last 2 years, I've lost 20 pounds just from doing these cases. It takes heart, it takes discipline, and you gotta wanna get it out. And when you get it out, it's so spectacular. It motivates you to do it even better. So whether they want me to put the fat back in their butt, or whether they want me to put the fat in their breast, or whether they want me to throw the fat away, I don't care. Sometimes I get patients that are like, well, I don't want the BBL part. You know, can you help me with the price? No. Because my BBLs take 10 minutes to do. So I have a closed loop system. Literally takes me 5 minutes per cheek. It's not a big ordeal. We had a question about Renuvion timing. The beautiful thing about Renuvion is it takes 10 minutes per area. So on this patient, I did all her abs, all her back, flanks, in no time, because I actually have, you know, as I'm vasoring and I move away from a region, they come behind me and start J-plasming. It's like a production, it's like a dance. Okay?
How many passes typically?
Always 6, sometimes 8. Just depends on the laxity. I'll show you an arm today that I did 10 passes on. Let's look at another view. You guys can be critical of these before and afters. It's a family affair. If you have any thoughts on what I could do differently. Okay, here's a 5.5. Now we've dropped it below a 6. So what am I going to do on her? I'm going to do some sort of a tucking, right? So she's a mini tummy tuck. And look, I was able to get this belly. You guys agree, right? This belly was worse than the last belly. And some would think, shit, that's a full tuck case. But I can get enough tightness in that belly by doing a mini tummy tuck and shredding her. Those are her muscles. Let's look at her before and after. It's all about these beautiful curves as best as you can. You gotta put your heart into it. You gotta sit there, look at it. Do the double fist technique. Put her down, lift her up. So we do circumferential prepping. Does anybody else do that? You guys know what I'm talking about?
Colombian style.
Colombian style. So we have them stand, put their hands up like they're getting arrested, and we go all the way around and wash them. And then they come and they sit on the bed, and the bed has drapes that are not your regular drapes. They're actually sheets and chucks. So I have a sheet, chuck, sheet, and they get sandwiched in there. And then what we do is we keep rolling them. So these patients, it's like a rotisserie, right? You keep working it and working it and working it. And why Grant gets these unbelievable results is right when everybody else is just destroyed. Okay, after 4 or 5 hours of grinding, if you're doing it on your own, you just feel destroyed. And he'll come in there and say, one more round, boys. Let's go one more time. Just work it, work it, work it. Okay? So you get this young lady from a 5.5 to, I would say, a 9. Grant would probably give her an 8, but she's hot. And she wasn't hot before. Let's look at her other views. Those are her muscles, 4 packs, waistline, maximally narrow, gentle transition zone, full butt, legs. Back. Look at her. She's a 5 on my scale. Little bit of extra skin, more than the other one. You'll see it on the other image. She had a little lap pulley scar there. But it is what it is. If you see this woman, she is hotter than hell. She is absolutely a knockout. And she's Colombian, and when she talks to you, you're like, oh my God. This belly is firm. Okay? Look at those curves. Look at that curve. How did I get her there? I did a mini tummy tuck. That's it. Tucked that belly down low. Was able to gauge it right. And then I just went to town on her. Look at that belly. All right. Let's move on. Here we go. So here's a 4. She's what I call a barrel. There's nothing there. There's no pop. There's no magic. There's no beauty to that torso. Most patients cannot fathom that you could take them from that. Yeah, they can go down and get a tummy tuck and they'll tighter in the belly. But this woman, if she walks into a room, all the guys will turn their heads. Okay? You can't tell from this angle, but look at this angle. Look, we cleaned up her butt. Did I make her butt bigger or smaller? What did I do? Shaped it. Made it smaller. BBL doesn't mean always go bigger. It means nail it for her torso. Get it right. Sometimes we're making it smaller. But we want to shape her. Again, I call this, I've written a couple of things on this, I call this the double bubble. You see this? One bubble in, one bubble out. And what we want is we want an hourglass. So we want to fill in the mid-butt level and take the flank and the lateral thighs out. Let's look at her other view. Look at her. Not as much definition in the abdomen, not because I didn't get the fat out, it's because she just doesn't have strong muscles. Still there though. So what did I do for her? I brought her in, I did a full tuck. She actually had upper body tuck, lower body lift. It's hidden under her bikini. It's really important for you guys to mark with the bikini on, so you know where to put your ports. You don't want them to show, so you have them wear their favorite bikini. And it can't be a string bikini, but something fair. And make sure you put your ports in those regions that are going to be covered. For example, the upper back ones, which are up here. You know, well, let me see if I have it wrong. Well, you get the point. If you're going to do upper and mid back, you got to put ports up high. And you want those in the bra line, right? Don't just randomly put them wherever.